India COVID crisis, government ignored warning on variant, scientists say. It's from The Guardian. Country's government failed to impose extra restrictions despite warnings of new, more dangerous strain in early March, expert came. A panel of Indian scientists warned officials in early March of a new and more contagious variant of the coronavirus taking hold in the country it has emerged. Despite the warning, four of the scientists said the federal government did not seek to impose major restrictions to stop the spread of the virus. Reuters reported on Saturday millions largely unmasked people attend religious festivals and political rallies that were held by Prime Minister Narendra Modi. Leaders of the ruling Bharatiya Janata Party and the opposition politician. Tens of thousands of farmers meanwhile continued to camp on the edge of New Delhi protesting Modi's agricultural policy changes. The world's second most populous country is now struggling to contain a second wave of infections much more severe than its first year, which some scientists say is being accelerated by new variant and another variant first detected in Britain. India reported another world record of 4,01,993 new coronavirus cases on Saturday, while deaths from COVID-19 jumped by 3,523 over the past 24 hours. Experts believe the real figures are far higher. Compounding the misery, a fire broke out in COVID-19 hospital ward in Western India early Sunday, killing 18 patients. The fire, which broke out at the Welfare Hospital in Bharuch, a town in Gujarat state, was extinguished within an hour, police said. The cause was being investigated. The spike in infections is India's biggest crisis since Modi took office in 2014. It remains to be seen how its handling of it might affect Modi or his party politically. The warning about the new variant in early March was issued by the Indian SARS-CoV-2 Genetic Consortium or INSACOG. It was conveyed to a top official who reported directly to the Prime Minister, according to one of the scientists, the director of the research center in northern India, who spoke on condition of anonymity. Reuters could not determine whether the INSACOG findings were passed on to Modi himself. Modi's office did not respond to a request for comment from Reuters. INSACOG was set up as a forum of scientific advisors by the government late December, specifically to detect genomic variants of the coronavirus that might threaten public health. INSACOG brings together 10 national laboratories capable of studying virus variants. INSACOG researchers first detected B.1.617, which is now known as the Indian variant of the virus, as early as February. Ajay Parida, director of the State-run Institute of Life Sciences and member of INSACOG, told Reuters. INSACOG shared its findings with Health Ministry's National Center for Disease Control before 10 March, warning that infection could quickly increase in parts of the country, the director of the Northern India Research Center told Reuters. The findings were then passed on to Indian Health Ministry. This person said the Health Ministry did not respond to request for comment. Around that date, INSACOG began to prepare a draft media statement for the Health Ministry. A version that draft seen by Reuters set out by the forum's findings. The new Indian variant had two significant mutations to the version of virus that attaches to human cells, and it has been traced in 15 to 20% of samples from Maharashtra, India's worst affected state. The draft statement said that the mutations called E484Q and L45-2R were of high concern. It stated that the mutated version of the virus could easily enter a human cell and counter a person's immune response to it. The ministry made the findings public about 2 weeks late on 24th March when it issued a statement to the media that did not include the words high concern. The statement said only that more problematic variants required following measures already underway: increased testings and quarantine. Asked why the government did not respond more forcefully to the findings, for example by restricting large gatherings, Sahid Jamil, chair of Scientific Advisory Group of INSACOG, said he was concerned that the authorities were not paying enough attention to the evidence as they set policy. Policy has to be based on evidence and not the other way around. He said, I am worried that science was not taken into account to drive policy. But I know where my jurisdiction stops. As scientists, we provide the evidence. Policy making is the job of the government. The Northern India Research Center director told Reuters the draft media release was sent to the most senior bureaucrat in the country, Cabinet Secretary Rajiv Gauba, who reports directly to the Prime Minister. Gauba did not respond to a request for comment. The government took no steps to prevent gatherings that might hasten the spread of the new variant, as new infections quadrupled by 1 April from a month earlier. Modi, some of the top lieutenants, and dozens other politicians, including opposition figures, held rallies across the country for local elections throughout March and into April. The government also allowed week-long Kumbh Mela religious festival attended by millions of Hindus to proceed from mid-March. Meanwhile, tens of thousands of farmers were allowed to remain camped on the outskirts of the capital of New Delhi to protest against new agriculture laws. We are in a grave situation, said Santa Datta, a medical research scientist at the state-run National Institute of Cholera and Enteric Disease. People listen to politicians more than scientists. The Indian variant has now reached at least 17 countries including Britain, Switzerland and Iran, leading several governments to close their borders to people traveling from India. Thank you.